understand what you're doing with the AMG Medical Group and the service that you're providing. I want to understand exactly why the government's getting involved with your price point, which is $79. Now, basically what they're stating is that, I guess it's illegal that you're charging this amount, and that they want you to charge more because it doesn't cover your overhead costs. Is that what you're saying?
I actually was saying I set the price to $79, unlimited visit, and plus all the services we provide in our center, which is very comprehensive.
Yes.
And it's a flat rate. It's $79 a month. It's a one-year contract, and the government had a beef with it. They said, well, this smells like too much like insurance.
Yeah.
You're running an insurance, and you don't have a license.
That's more like what a real agent.
But were they saying that the $79 doesn't cover your overhead costs? Is that what
No, they
saying?
don't. They're not saying, because I present this as a membership.
Yes.
Not as an insurance. I said as a membership.
Okay.
So, in order to be membership, you can do, as a member, you can have unlimited preventive checkups, because these are considered fortuitous events, planned. You can foresee it. So there is no risk involved. But when there is non-fortuitous events, like you cutting your fingers, or you're coming with a cold, pneumonia, these are non-planned visits, so you cannot estimate the risk.
Okay, where did the government come up with the $33 extra if you're sick?
They said if you're running a membership, for sick visit, at least you have to cover your overhead costs.
Okay, now
they enforce that overhead cost on the sick visits.
So basically, are they dictating to you that $33 is your overhead cost for a sick person to come?
No, we calculated it. We told them it's $33.
That's what you told them?
Yes, I told them. Maybe it's more right.
So it's like additional cost per visit, right?
Yes. If you're coming for a sick visit, if you're not coming for a sick visit, if you're coming for a checkup, it's free, still free. And it's a contract, so it's $79 flat rate a month. And they said it looks like too much like an insurance, so that's what I guess. I told them this is not an insurance.
And of course, the insurance companies look too much like a free market.
I just wanted to understand.
What happened?
Is the government regulate? I guess it's trying to regulate what you want to charge for the membership, which is the group that you've started.
Yeah, actually, they want to shut it down. They said you're running insurance business, you're violating the law, you don't have a, you don't have license, so shut it down. So we knew the law, so we tried to. We offered a compromise, and they took it. So I was able to start the whole program.
I just want to understand your
very nice program.
Yeah, no, I want to understand your alternative to the healthcare system we have, and why it should work, and what the pros and the cons are.
This is beautiful. I'm hoping this will be modeled across the country.
Yeah.
I mean, really, to be honest with you, I mean, I want you to all go to the website and look at our look at the website and the amgmedicalgroup.com. And you'll see what we're offering. It's unheard. I'm not really kidding. It's unheard what we're offering for $79. And I'm quite sure it also makes sense from a business point of view, because if you reach a certain amount of membership, then it's just run by itself. It doesn't being subsidized anymore, because at this moment it's being subsidized by my other practice. But once you reach a certain point, it's not subsidized. And I'm quite sure other doctors, if they follow this model, and we need about 60,000 such facilities for the entire United States. That's all we need, really. And everybody will have excellent primary care. And if you go to on the website, you see the list of services. It's huge. I really advise you to go and see it.
I'm a healthcare pricing actuary, so I dealt with the New York State Insurance Department, and believe me, I feel for you. I really do. It's one of the worst bureaucracies I've ever dealt with, and with people who just don't understand reality and just go by what they see on Facebook and all that. But I think what they were trying to do with your, with trying to regulate you, at least and whether their tactics would have been successful or not, I don't know. But their goal was to say, okay, people are paying this money every month for your services, and they want to make sure that they will actually be able to get the services that they're paying for, and that money will be adequate to fund those services, and that too many people come in with too many problems and overwhelm your cost, that's not going to drive you bankrupt, and then they wouldn't have the services they paid for. That's their stated goal. Now, the way they go about doing it, and the way they, and the lobbies that are involved and the politics involved in that is another, is the kind of issue that, like that gentleman says, we really should be talking about.
John,
I guess your argument though, but
Is he going to answer that before I answer?
Yeah, let me answer.
I'll answer.
Because my cost is fixed. I have 5 centers. My employees are fixed. The rent is fixed. Everything is fixed. I don't carry any more risk. Yes, I mean, I have list of services I'm going to provide. It's listed on the website, and the locations and the hours where we open. That's what I'm promising. I'm not promising that I will cover you for certain diseases. No. Yes, we can fix 80% of your problems, but if 20% comes up, I cannot fix it. I have to send you out.
Right.
I mean, just recently we had a gentleman who was signed up for 3-4 months, and he was coming, and then just a month ago, in one visit, he says, "I have those lumps here. I don't know what they are." I looked at him; he had lump all over. So next week I brought him back. I did a biopsy in the office under local anesthesia. I took one of the lymph nodes out, sent it for pathology. And unfortunately, it came by a Hodgkin lymphoma. I couldn't help him, so I sent him to the hospital. He was admitted to Bethesdale, and I think they're going to give him some chemotherapy.
And that's the main difference when you have like a real HMO. And what you're doing is actually what HMOs originally, when they first started, before the HMO Act, what they were trying to do is have a fixed cost, and then you go in whatever your problems are. But what you're not covering is the big ticket items.
No, I can't, impossible.
Right, and that's what real insurance is.
Yes,
So
exactly.
what you're providing is not really insurance.
No, it's not real insurance, but they actually, we have a bill in the Senate, in the New York State Senate, by Senator Lanza. He's trying to remove the primary care from the insurance law. So this way it doesn't come under that, and I can charge without being regulated.
Which ironically, the insurance company, even 15 years ago, didn't cover a lot of products. It was
Yes,
more
that's
like real
true.
insurance.
John, did you want to ask the same
Yeah,
question?
I agree with what you say about third-party payer, and that should only be for catastrophe or emergency, sort of like how it used to be years ago. With regards to the supply of doctors, should the government be allowed to grant this monopoly to the American Medical Association? Would it be preferred if we had a system where maybe instead of licensing, there were certificates? So the Harvard Medical School would have a certification that they could grant to various doctors, and they would have a reputation-based system. So I would go to a doctor that's certified by Harvard Medical School, and that would be good. Or maybe NYU Medical School wouldn't be as good. So you have this system of competition amongst doctors and an increase in supply of doctors as well.
But you're working
Instead of
against...
AMA artificially limiting the supply of doctors
No,
and
but you-
making 500,000 a year or whatever they make.
But you have to make it free for other physicians to open their own practices. And that doesn't necessarily to be connected to Harvard or NYU or anything, because they're going to add to the cost, believe me. You have to let the doctors and the providers open their own centers, set their prices, and you're going to choose any center you want on the basis of service and cost. Let this be the decisive factor, not whatever it is. You're going to go check that center, you're going to see the doctor, you're going to say, okay, this is my doctor, I'm choosing this as a primary care doctor, and
But
you're going to have a relation there.
the act
And
of
if you don't
him
like
being-
the relation, then you switch.
The act of him being a doctor is top-down controlled by the AMA, and the AMA gets...
No. AMA doesn't control the doctors at all.
There's state boards and licensing.
No. This is AMA has nothing to do with those. State, our license is granted by the state.
If you don't have a license to be a doctor, can you practice?
No,
Who gives you the license?
the state.
And then the state boards go up to American Medical Association?
No. Has nothing to do. American Medical Association is a private organization formed to bring the doctors together and address their issues. It has nothing to do with regulatory. Actually, there was a couple of days ago, there was some kind of report on the TV saying that the AMA is actually now is more like insurance, not insurance, but because they have the certificate, the coding, the lobbying group, but also they have this coding books. They have the certificate for those coding books, so they charge, licensing fee, and that's how they survive.